Joining us is Natasha Robinson, the health editor at the Australian newspaper. Natasha, give us a snapshot of how the vaccine rollout is going. As you heard from our reporter Patrick, there certainly no queues at that mass vaccination hub there in Melbourne. It looked like pretty empty rooms that we were seeing there today. Australians taking their time, perhaps.
Yeah, look, I think that's probably not a reflection of the way that's going to go. It is the first day that these have been open widely to the public, so a lot of people just wouldn't have heard about them yet, as Patrick pointed out. I do think that there is quite, the authorities have been quite upfront that there is vaccine hesitancy in the community that has increased markedly since the reports of these blood clots have emerged. I think what they've been saying is that the elderly are actually a lot less likely to be vaccine hesitant as people aged under 50. So, people, they're particularly concerned about healthcare workers, and of course they're not the ones who are going to be turning up at these mass vaccination hubs. In terms of how the rollout is going generally, it is certainly still proceeding pretty slowly, although it is picking up. We heard quite a detailed amount of evidence yesterday at the COVID committee in the Senate, given by Professor Brendan Murphy, as well as the Chief Medical Officer Paul Kelly. I think the most critically concerning thing that was raised at that hearing was the progress in disability care homes. It really is incredibly difficult to believe how slowly the rollout has been progressing in disability care homes and among staff. There's virtually no staff working in disability care homes that have been vaccinated. The numbers are quite shocking in terms of how slowly that rollout has been proceeding. Really, 6.5% of people in disability care homes so far vaccinated. That's 1,500 out of 25,000 residents. That's only 93 out of the 6,000 disability care homes have been visited so far. So we're told this is going to ramp up in the coming from next week, basically. But I think it's, you have to take what Professor Brendan Murphy said, and we really need to critically analyse this statement as May approaches and comes towards its end. He said that the rollout of Phase 1A will certainly be finished. I think he was talking about age and disability care homes here. It will certainly be finished by May. It's going extremely efficiently now. Now, one can only presume he was talking about sometime within May, not, given that May's coming up in a matter of 11 or so days. But it does seem on its face quite, surprising to think that we could get through literally, the 5,000 and 900 odd disability care homes that haven't yet been visited all during the course of the next 10 days or throughout May. So hopefully that is going to be able to happen, and we certainly need to hold the government to account for that particular promise.
Absolutely. And Natasha, when it comes to the supply issues, we heard that announcement from Victoria today saying it wants to be able to produce mRNA vaccines locally. A lot of experts who have been speaking to the program are saying, well, yeah, that's great. Hindsight is a wonderful thing, but a lot of them seem to be saying, well, why hasn't this happened much sooner than this point?
Yeah, sure. And this was placed on the agenda more than a year ago. And people who are, experts in mRNA vaccines have been calling for this for a long time, even before the pandemic. People could see that these vaccines really are the new generation of vaccines that are going to be coming through. They're going to be used more widely than just COVID. Now they've really proven themselves and come to the fore in terms of COVID. But the Pfizer and Moderna vaccines are certainly the main vaccines being rolled out right across the United States. We're relying on Pfizer's overseas supply, which we're getting in dribs and drabs. And we heard yesterday that there's really, no 100% guarantee we're going to get all 40 million of our doses by the end of the year. So I really do think that this local manufacturing of mRNA was a very high priority, and it's hard to understand why it hasn't been actioned yet. The federal government has done a feasibility study money, paying McKinsey and Co a couple of $1 million to undertake a feasibility study. The results of that haven't been issued yet or made public, but the Victorian government really have wedged the federal government here because they put money on the table. They're not able to actually get this plant up off the ground without federal money as well, but you can't really imagine the federal government turning around and saying, sorry, we're not going to give this to you, we're not going to fund this. Not sure what their plans were in terms of where they wanted that manufacturing capability to take place, but Melbourne does seem like a logical choice given CSL's factories are based in Melbourne. CSL's just building a massive new flu vaccine factory out near Tullamarine, so certainly there's a track record in Victoria of expertise in this regard, albeit not in the mRNA space, but Melbourne certainly is a vaccine manufacturing hub, so hopefully we can see this happen.
Natasha Robinson, always appreciate your insights. Thank you.
Thanks, Ash.